Hello and welcome. In this lecture, we're going to talk a little bit about how, based upon the research question that we've identified, one would go and actually collect the information that you need to answer your question. Now, there's many different ways of doing this. In fact, if you go from one study to another, pretty much every study is going to have slightly different variations on different data collection strategies. So it does take some time to figure this out. That being said, there are some common strategies that are used across studies, and we're going to talk about some of the major ways that this is done. We're also going to talk a little bit about what this means and some of the things that we would think about in terms of doing this carefully and responsibly. So for data collection, it's really crucial to have integrity and have a lot of care as you're collecting this information. Now, the truth is that very often, just by reading a paper, you often can't tell exactly how carefully a data collection strategy or plan was followed in that study. So that's why it becomes even more important for a researcher to be extremely careful to make sure that different people are being treated the same way in their study so that you don't have strange biases that creep into the study. When we're thinking about how to collect data, there's a few different things that we would consider. So, figuring out what you're trying to do, what your design is, what population you're going to be working with. Different types of data collection cost different amounts. So how much money you have is going to determine partially what strategies you choose. And sometimes, there's different strategies, some that are very quick and some that take a lot of time. So these are all different things that can influence what data collection approach you end up using in a study. The other thing I just note here is that sometimes studies actually use multiple data collection strategies in the same study. For example, you could both interview people and also do a survey with them. Now, this can be handy because the more different strategies you use, sometimes the better or more accurate understanding you have of how they're viewing the situation or what their experience is. But it does require more resources and time, so that is something that is a trade-off that researchers think about as well. And this is all just a process where you have to think about, as a researcher, what the different strengths and limitations of the approaches are and how well it fits what you're trying to do and accomplish in your study. So I want to mention a couple of things here about what we would think about with respect to evidence-based practice and how to view the approaches that are used. So one thing is I want to remind you that the process by which data is collected can be just as important as analyzing the tools and the specific questions that were asked, for example, that are reported in the study, because that process can really change things. So if I were to give people a survey in a certain group, I told the people, it's really important that you get this right and be very careful about this. And the other group of people, I just handed them a survey said to them, fill this out when you get a chance. You might actually get very different results from those different groups, right? So the quality of this process, the reliability of this process is actually really important for the results of a study. So when you're looking at a study, when you're looking at a research paper, you should be able to understand from that paper why the researchers made choices about using different strategies. And they should be able to say something about this in the paper so that you have some idea of why they chose to do things the way that they do it. And if something looks odd and you can't figure out why they did it, well, you need to take that into consideration as you're evaluating the study and how much you trust it. So another thing to think about here, and this is generally important, is what exactly did the researcher collect in terms of the data, and how well does that actually match their research question and what they said that they're collecting, right? It's unfortunately the case that sometimes what people collect may or may not actually accurately match what they said that they were going to do. So understanding what's in those surveys, what they're measuring, and whether that actually is what you're really interested in is something that's important for someone to be thinking about as they're reviewing a research paper. So as I mentioned, there's a lot of different strategies, and this is great because as a researcher, it gives you options, right? So if you're thinking about things in different ways, you can decide what strategy is most suited to answering your question. So sometimes more qualitative approaches will be better if you're asking certain types of generative questions, especially questions where you don't know even what participants are likely to think in general about them. Sometimes you're really interested in getting very specific information about questions that you already know a bit about, so you can actually design a survey for it. It really varies depending on what you're trying to do. So I'm going to walk through these different strategies and tell you a little bit about them. So this isn't necessarily a strategy, but this is a distinction that I just want to make clear for you as you're thinking about data collection. And that is primary or novel data versus secondary data or accessible data, right? So primary data is what we're usually talking about when a researcher goes out and collects information themselves, all right? So this is data that's collected specifically for the study. Now this requires more work, but the advantage is that you can actually design your study and design all the tools and approaches that you use to specifically address the question that you have, and you can have a lot of control over that and how the questions are asked. There's another term which is called secondary data. Now secondary data is when you're looking at data that has already been collected and you didn't collect it yourself, okay? Very often when we're talking about health research, very often secondary data is actually from medical records. So electronic medical records are wonderful for doing research and a really great strategy. And there's a lot of advantages to doing things this way. So it's really fast, right? Because the data's already been collected and you don't have to do anything. You don't have to do much except try and analyze and process that information. However, it also has some disadvantages. So one is, since you didn't collect the data yourself, it may have biases in it that you don't know about. And you also don't have flexibility because you can't adjust the questions to address exactly what you want to be addressed in that study. It's what people have already collected, so there's not much you can do about it, right? And because of the availability of a lot of this data, it's very often used very widely in evidence-based practice with respect to clinical work. So a lot of meta-analyses, for example, will use secondary data. So secondary data also can refer to pulling data from other research papers that have already been published. So you're using other people's research as well. So that's kind of an interesting element to secondary data. But again, secondary data is, again, where you haven't collected the data directly yourself, right? You're using somebody else's data that they've collected. Another strategy is interviews, and this, as you know, is basically where you're sitting down and talking to people. Typically here I'm talking primarily around talking to people one at a time, but sometimes it can be more than one person. This is a strategy that's used very often for qualitative research. I would say possibly a majority of qualitative research uses this strategy where a researcher has a question and they identify people who might have thoughts or perspectives that are valuable for understanding that question, and they go in and they interview them. Now you can also do this for quantitative research as well. So by the same token, if you have a question, you could identify people who you want to talk to, and you, instead of doing a survey where you ask them to fill out a form, you could ask them various questions, and you could quantitatively measure it. So if you're asking them whether or not they can remember the last time that they had a physical, well, you could record the things that they say as answers, or you could just click a box that says yes or no as you're listening to their responses. So you can also interview people to get quantitative as well. Now, interviews have real advantages in that they have a personal touch. Like, people appreciate that connection that you have with people. It also it does require, and a part to it, requires some element of trust and connection to the people that you're working with. If someone doesn't feel comfortable with you, they're not likely to feel comfortable talking openly with you, and may not give you the data that accurately represents what they're thinking. The other thing to know here is that sometimes the data that you collect can be biased by the interaction that you're having with that participant, because people can see how you're responding to what they're saying, and sometimes people actually change what they're saying based upon how they're understanding how you're responding. You also have to think about both how you set up the questions for your participants and also the type of environment that you're in. If you're in a really busy, distracting environment, it might affect the types of data that you collect. Another strategy is focus groups, and we're probably kind of familiar with that. That's used very often in, for example, market research, for example. But it's used very successfully in research as well. And the idea here is that you're pulling together a group of people who have an interest in a question that you're interested in, and you have a conversation with them where you ask questions of them, and they talk together, and you listen to what they have to say, and that's the data that you then analyze. So this is often a qualitative approach that you would use here. I don't know of many quantitative studies that would use this strategy, so it's typically qualitative. When you do this, you usually have roughly 6 to 12 people who are in your study that you work with. If you get much less than this, then your data starts getting pretty shallow sometimes because there aren't enough people and enough different perspectives. If you get much over 12, then you start getting biases because people stop feeling comfortable talking. Often the conversation doesn't flow as well, and some people start dominating the conversation. So that's sort of the general size that you see for focus groups. Now, what's interesting about focus groups is you usually want groups where people are pretty similar. They have similar interests. They tend to connect with one another because people are similar, tend to talk to one another more easily and more comfortably. So that's often a strategy that's used in this focus group approaches. How you do it, usually it's, 1, possibly more hours, up to 3 hours perhaps, where you're talking with this group and recording what they're saying and using that data. Now, when you do this focus group, you do have to have a leader who can help facilitate it to make sure that the questions are asked, make sure people are comfortable, and make sure that the conversation continues to flow smoothly as you go forward. Now, this is really useful when you're trying to understand people's opinions and experiences, and you're looking at people who have shared experiences, right? Sometimes, actually, by talking to people in groups, they sort of play off of each other, and you sort of get an idea of what the themes are that people are experiencing. There's also, like for interviews, you have to make sure that people are comfortable, that they're in a private space, and that where you're holding these interviews are convenient to the people who you're trying to pull together to do your focus group. Now, another strategy is observation, and this is a really effective strategy where you're essentially, as a researcher, observing what's going on in the world around you. Now, this is used both for quantitative research and qualitative research. So let's say that you're looking at how children respond to how children behave in a waiting room, right? As they're waiting for clinical care, right? So, you could do that study, observe them, listen to what they're talking about, and describe what it seems like they're doing. So that would be a qualitative approach. Or you could use a quantitative approach where you're saying, all right, how many times does a child play with the toys? Or how often does a child get upset waiting in the waiting room, right? So you could also use that quantitative strategy. Now, what you're doing here is you're collecting descriptive information because you're observing it, right? So you're describing what's going on there. Now, the problem with this is that when you as a researcher are observing something, there's a real possibility for your preconceptions and beliefs resulting in bias. So if you're making assumptions about whether a child is happy or unhappy, right, that's based upon your own assumptions of how a child is behaving. And maybe children behave differently than what you expected, right? So when you're making these interpretations through observation, you have to go through a training process to make sure that you're as accurate as possible, and you have to have some modesty about your actual ability to accurately interpret what you're seeing. So again, being really clear about this, creating tools or methods for collecting this information accurately is going to be really important for observational strategies. I'll note that some qualitative research uses observation very extensively, especially ethnographic research. And that's where you actually go to a community and you become involved in that community, and you actually connect with the people and engage in community events, for example. And by being part of that community, you're observing what's going on. And that's very often the types of information that you're going to be talking about there. So I just want to mention that as one type of qualitative research which relies on this very extensively. Now, biophysiological methods is an approach that is used very widely in health-related research and nursing research. And this is what you probably are thinking of in the sense that it is measuring biological data. Blood pressure, or you're doing swabs to see if somebody has an infection of various different sorts. So you're actually looking at someone's biological states. Now, biophysiological approaches are usually quantitative, and they're often seen as being a little bit more objective in terms of the results that you get, because very often these physical states are less prone to sort of social influences of various sorts. Now, that doesn't mean that biophysiological methods are entirely immune to social impacts. Like if someone's really nervous, their blood pressure might go up, right? So there are relationships there, but it is generally speaking seen as being more objective, and there's real power to combining different types of methods here to get both the social side and the quantitative side as well, and using these biophysiological methods. Sometimes how you do this varies. Sometimes it requires cheap equipment. Sometimes it requires very expensive equipment, so that influences the type of studies that you can do. Also, when you're doing certain types of study approaches, which we'll talk about at another point, it's very often used for experimental and quasi-experimental studies. So randomized controlled trials, things like that. Drug trials, for example, very often what they're measuring there are things like biophysiological responses of various sorts. Just for terminology, remember that there are two different types of biophysiological data. One is in vivo data, which is essentially saying that's in somebody's body, right? So you're measuring it in somebody's body. So someone's temperature or blood pressure or something. That's something that's going on in the body as you're measuring it. You can also have in vitro measurements, right? Where you're actually extracting something from the body and doing some sort of study in the laboratory, for example, looking at whether or not somebody has an infection, for example, or glucose levels or something like that, right? So those are two terms that you should just be familiar with. Another major strategy used in health research is questionnaires, all right? So questionnaires, you're probably familiar with them. I'll talk more about them at a later point, but we're asking questions of people that they can fill out, and they can do this online, they can do it on paper. You can actually interview people and fill out the questionnaire for them by asking them questions. So there's a lot of different strategies for doing this. Questionnaires are often quantitative. You can also have qualitative elements to questionnaires. For example, you can have open-ended questions where you ask a question, for example, how did you feel about your visit to the clinic today? And people can write out what they have to say, and that would be a qualitative response to things. Very often using, again, a survey process for doing this. Now, questionnaires can vary a lot in terms of quality, in terms of the information that you get out of it. Sometimes you have single items which may or may not be of good quality. It could be something that someone just came up with and maybe is poorly worded or not, you don't know. But sometimes it can be actually very high quality. So you can have tests or scales which are already validated, and I'll talk about that in a second. So it's very useful for situations where you're trying to collect factual information about people's knowledge, attitudes, beliefs, how they feel about things, sort of more of that, those types of behavioral mental states, all right? It also is, again, typically self-reporting. So you can, so usually you ask people to say about how they're feeling. Sometimes you can ask them, for example, you could ask a parent how they think that their child is feeling. But it's typically someone that self-reports their own perspectives. So why are questionnaires useful? Well, they're pretty quick to administer. You can use them for a lot of different circumstances. They're not expensive. You can do them with a lot of different people without a lot of trouble. Very often people feel more comfortable answering certain types of questions that might be more sensitive on a survey because it feels more anonymous. And you can also just get a lot of data because of the ease of getting it, right? Now, there's some problems with it. Sometimes you've seen questionnaires that are very long, so if you don't keep it pretty short, sometimes that can be a problem for your study. Another problem sometimes is when people don't respond to different parts of a questionnaire. So if you're missing data, then that can prevent you from actually addressing your problem or your research question. If you don't have any validated scales or tests, which I'll talk about in a second, the quality of that questionnaire may actually be questioned by people. People may or may not trust that the questionnaire is actually well designed and got the data that you would hope it to get. There are also a form of questionnaire, a form of approach to surveys, which I'm going to be calling validated scales or testing instruments, are surveys that have been designed and validated to essentially very effectively measure certain types of information. So they've been tested a lot of times. They usually ask questions in a certain way so that you get a strong, you have a strong belief that what they're measuring is actually accurate, all right? Now, validated scales and testing instruments are actually pretty highly regarded when we're thinking about different types of health information and attitudinal research, right? Because of this, because they've been used in many different circumstances, there's a lot of information about them. They just are very well respected, typically. So they're almost always quantitative. They are usually done as a survey. Again, referred to as validated scales or testing instruments. What they can do is they can operationalize certain concepts that are complex to understand. Things like intelligence or talents or behaviors or some sort of cognitive trait, right? There are lots of different tools that have been designed to try and measure this reliably. Now, for these concepts that are complex, your survey, your scale, sometimes it measures things in very specific ways which may or may not connect to what some people view that concept. So the common example of this is the IQ test, right? IQ test measures IQ, what they're measuring, very reliably, but whether or not they match up with what we think about as intelligence is kind of a controversial question. But these tools are generally more highly regarded than something that you just sort of make up yourself. So again, there's real advantages to this. There's consistency across studies. So many studies use these scales, so you can compare what you find in your study to what people found in other studies, and you can compare across populations. So it tends to be more reliable and valid. As you use these scales over and over, they become stronger and stronger in terms of what we think about it. You can use them sort of like surveys. There again are relatively fast, cheap, and don't take too much time to do. There's a lot of validated scales that are already out there. I have books in my office where you can just look up different validated scales that have been studied very, very extensively, and you can use them for what you're trying to address. And they're also pretty easy for analyzing the information that you get. You can put them into a software, and you can just churn out information that way relatively fast. Some of the problems, sometimes you have to pay for these scales. Some of them are proprietary. Sometimes they have issues with those scales and you can't do anything about it because the scales come as a package and you kind of have to use all the components to it. If you pull elements out of it, it's no longer seen as being valid. You also can't typically ask open-ended questions. You can't ask those qualitative questions in the scales or tests, right? So for certain types of things, you actually want to be able to ask those more open-ended questions. The other thing is that when you're missing a component to a scale, it becomes a really big problem for accuracy. So if somebody forgets to answer one of the questions, sometimes you have to throw out the entire scale for that participant. So if you have a lot of missing data, that can be a real big problem. Now, when it comes to data collection, as I mentioned, it's a very diverse approach. So, you can use lots of different strategies beyond what I've talked about here. So, for example, you could ask someone to fill out a diary talking about their experience with a health condition, right? And then you could analyze what people have written in their diary. I have a colleague, for example, who looked at blog posts or, discussion board posts, and they analyzed what they took a random sample of people's discussion board posts on a weight loss site to try and think about what people's experience was with that. And you can sometimes get different types of data there. Some researchers, for example, give people cameras and ask them to photograph their things that they're experiencing in their life, and then they analyze what people bring to them as data in the form of photographs. You can do historical research, for example. So you can look at news articles. There's tons of different ways to collect data in different types of health research. The other approaches I mentioned earlier are kind of more common strategies, but one can be creative and novel and think about these other strategies as well as we're thinking about these different approaches. So that's really an overview of the different types of health data that we collect in health-related research. There's a lot of opportunities. The approaches for doing this and the choices people make for why they pick different strategies are really important. And being able to read a research paper and think about whether or not they used an appropriate strategy and understand why the researcher used the strategy they used is an important thing for you to be able to do. So I hope that was helpful for giving you an overview, and we'll talk more about that as we go out throughout the term. But some very interesting questions to consider there. So thank you very much for listening, and take care, everyone.